and welcome.
Dengue fever.
Dengue fever symptoms.
Dengue fever is a mosquito-borne viral disease that affects millions of people worldwide, particularly in tropical and subtropical regions. We will explore the causes, symptoms, transmission, prevention, and treatment of dengue fever. Dengue fever is caused by the dengue virus, which is primarily transmitted to humans through the bite of infected Aedes mosquitoes, particularly Aedes aegypti. There are 4 different serotypes of the dengue virus, and infection with one serotype provides lifelong immunity against that specific serotype. However, infection with a different serotype can lead to more severe forms of the disease. Symptoms of dengue fever typically appear 4 to 10 days after being bitten by an infected mosquito. Common symptoms include high fever, severe headache, joint and muscle pain, rash, and pain behind the eyes. Other symptoms may include bleeding from the nose or gums, easy bruising, and mild to moderate bleeding in various parts of the body. Severe forms of the disease, known as dengue hemorrhagic fever or dengue shock syndrome, can lead to life-threatening complications, such as shock and organ failure. The transmission of dengue virus is primarily through the Aedes mosquito. Female mosquitoes become infected with the virus when they bite a person already infected with dengue fever. Once infected, the mosquito can transmit the virus to other humans through subsequent bites. This cycle perpetuates the spread of dengue fever. Unlike many other mosquito-borne diseases, dengue can also be transmitted from mother to child during pregnancy or through blood transfusions. Preventing dengue fever is crucial in regions where the disease is endemic. The most effective method of prevention is to reduce the breeding sites of Aedes mosquitoes. This involves eliminating standing water, which serves as a breeding ground for these mosquitoes. People should ensure that containers, such as flower pots, buckets, and old tires, do not collect rainwater. In addition, using mosquito nets, screens, and wearing protective clothing can reduce the risk of mosquito bites. Vector control measures, such as fogging and the use of insecticides, are also implemented in areas with high dengue transmission to reduce mosquito populations. Community education and awareness campaigns are essential to inform people about the risks of dengue and how to protect themselves and their communities. Vaccines for dengue fever have been developed, but their availability and effectiveness vary. These vaccines are generally recommended for individuals who have already been infected with dengue, as they can help prevent more severe forms of the disease upon subsequent infections. However, vaccine coverage is not yet widespread in many dengue-affected regions. In terms of treatment, there is no specific antiviral medication for dengue fever. Supportive care is the primary approach. Patients are advised to stay well hydrated and manage their symptoms with pain relievers that do not contain aspirin, as aspirin can increase the risk of bleeding. In severe cases, hospitalization may be required, with careful monitoring of fluid levels and blood platelet counts. In conclusion, dengue fever is a significant public health concern in many parts of the world, particularly in regions with a high prevalence of Aedes mosquitoes. The disease can range from mild flu-like symptoms to severe and potentially life-threatening forms. Prevention through mosquito control and public awareness is the most effective strategy to combat dengue fever. While vaccines and treatments are available, their accessibility and effectiveness can vary, making prevention and vector control crucial in reducing the impact of this disease. As global efforts continue to address dengue, the hope is to reduce the burden of this mosquito-borne illness and improve the health and well-being of affected populations.
லைக் பண்ணுங்க, ஷேர் பண்ணுங்க, சப்ஸ்கிரைப் பண்ணுங்க, மேல இருக்க பட்டனை கிளிக் பண்ணுங்க. Thank you. Bye bye.